Today we are going to look at social casework in a medical setting. What is social casework's role in a medical setting? Professional social work is defined as systematic interaction between individuals and their environment for better social functioning. Medical social work inculcates the methods of social work which are particularly relevant to helping persons who have health and medical problems. This is the major accountability of the social caseworker, not the medical practitioner, to ensure that once the patient is discharged from the hospital, will be able to come to his normal life. This lesson is about how medical social worker practice social casework in a medical setting. On completion of this lesson, you will be able to comprehend the importance of social casework in a medical setting and analyze the role of social caseworker in a medical setting. In social casework, the emphasis is placed on a social diagnosis. Identify the social process of adaptation of personality based on the continuous interaction with the social environment. Sickness and health are the result of interaction between biological, psychological and social factors of the individual. Social casework services begin from outpatient departments, the wards and special clinics in the hospitals. Doctors do not have enough time for considering the social and familial connectivity in the medical diagnosis. This is the area where social caseworkers can work as mediator, enabler, coordinator of services, case manager, mobilization of family, community and hospital resources and acting as a member of the team of professionals. The major tasks of a social caseworker are working with patients and their families in a medical setting. Social casework method is based on systematic practice experiences including psychosocial study, diagnosis, treatment, termination and follow-up for solving the problems of the individual to improve their social functioning. Evolution of field of medical social work. Medical social work is regarded as the practice of social work in connection with medicine. The social caseworker in a medical setting need to have more knowledge of physical and mental ill health condition and various methods of treatments compared to social workers in other fields. Medical and psychiatric social work skills would be utilized more than for good health promotion, specific protection against certain ill health condition, case finding, enabling the cases to see diagnosis and from treatment, disability, limitation and rehabilitation. This would involve not only work with the individual but with groups, communities for practice. Practice of social work in medical setting has concentrated so far on casework methods. There would be an opportunity for using other methods as well. Typical day of a social caseworker in a medical setting would involve the following. A day in a medical environment begins with an assessment of new admissions to the hospital, referrals and unresolved issues concerning the case of the previous day. The day will often continue with different units to collaborate with doctors and nursing staff to the planning for the patient. In addition, a social worker will spend part of the day with effective implementation plans of discharge or resolution of the problems of the patients. This includes the patient and family gatherings and often meetings of the healthcare team. One of the major roles of the social worker is crisis intervention. So, the day of the social worker never goes as planned. There may be a death on a single unit where the family has need of grief counseling, a case of alleged child abuse on another unit where an assessment must be made to help the team to report to child protection services. And of course, There are always members of the care team and patients who need to talk to the social worker now. Social work in healthcare requires a good dose of patience with great skill in the prioritization of cases and intervention. Day of the social worker can end with finishing and a conclusion of documentation, such as the entry of documents or statistical data, and in an ideal situation, briefing session with colleagues. Social caseworker should have knowledge of medical terminology, understanding of the roles of the healthcare team, comprehension of the psychosocial aspects of illness, knowledge of community facilities and resources for the planning, counseling skills, crisis intervention skills, knowledge of the skills of the care planning personnel and process planning skills required for social caseworker in a medical setting. The skills to establish effective relationship with multidisciplinary professionals and other stakeholders in the system such as doctors, pharmacists, nurses, nutritionists, psychologists, teachers, volunteers and patients, families and other social work professionals in healthcare. Skills to evaluate global, holistic and contextual bio-psycho-social aspects of social work in healthcare. Firstly, skills to plan and implement treatment interventions using approaches based on available evidence and appropriate care arrangements and their client populations, and skills to properly use medical terminology in the accurate written documentation and oral communications between and among the staff. Example, a social case work in medical setting includes referral. The consultant doctor refers a male patient admitted in the cardiac unit to social caseworker. He is from a village where there is no good medical services for cardiac illness. The various problems that the client faced due to his heart condition are difficulty in breathing, severe chest pain, dizziness, extreme tiredness and anxiety. The casework process study. The social caseworker met the patient and told him about doctor's referral. It is learned from his family history that the client is the only child born to the couple in non-consanguineous marriage. The client lost his parents a few years back. He now resides with his wife and 3 sons. He has a daughter who is now married and settled elsewhere. The family income is Rs 9,000 per month. They own a vegetable shop. The client has studied up to class 8th, whereas his wife and daughter has received no education. However, their sons are pursuing higher education. The client is the head of the family and makes all the important decisions. Overall, the family shares a good bond and relationship and work together. They share their problems and worries with each other and try to solve and help each other in times of need. All the family members are religious. The family does not receive any support from other family members or friends. There is no history of any heart disease in the client's family. They earn around Rs 4,000 per month. One of their sons is working in a cement company and supporting the family financially. The son earns Rs 5,000 per month. 2 of their sons are studying and often help them in running their vegetable shop. The client and his family have applied for grants to trust to support them financially as they cannot afford to pay for the entire treatment at the hospital. The client's wife is very supportive of him and takes complete care of him. She is, however, worried about his health condition and recovery and hopes that he does not face a lot of stress and worry. However, he can get easily stressed. At times, he is not able to cope and gets angry and feels frustrated. they do not have many close friends as such to help them. The organization is ready to lend as much as support needed by the client and his family. The hospital has provided counseling services to the client and his wife. They are also providing him certain financial support. The social caseworker helped them by applying to some organizations for funds. The hospital itself has sanctioned a certain concession amount for the client's treatment. Assessment. The client is going through a lot of stress due to financial conditions and also constant worry about his children back home. He is also worrying a lot about his health and surgery. It is understood that the client is not getting much help from extended family or friends. The stress and worry results in him getting frustrated and angry. Intervention. The client was given counseling in order to help him manage and cope with his stress. A lot of psychological support will help the client to reduce his stress levels slowly by making him understand the consequences. At the individual level, as soon as he was admitted to the hospital, he was counseled by the social caseworker about his socio-economic status, emotionality, the worries and concerns he had. The reasons for his stress were identified. He was clearly explained as to how the social work department can help him financially and emotionally. He was also counseled before and after his heart surgery. He was always motivated to think positive. The social workers helped him reduce his stress by making him understand the importance of stress management and how it would make recovery possible. At the familial level, the client's wife who had accompanied him was also counseled and given psychological and emotional support. She was clearly explained about her husband's treatment and the care and understanding that he would need from her. Evaluation. The interventions helped in reducing the stress levels of the client to a great extent. It also helped his wife to reduce her stress. The interventions helped both of them to express their worries and concerns and express their emotions. This helped them psychologically and therefore they were able to cope and deal with the situation better. Termination. The case is therefore formally closed. Social caseworker encourages them to meet whenever they feel the need. They thank the worker for all that she had done for them. Follow up. Social caseworker visits client in the ward occasionally and seek feedback about the client's recovery from the doctor and the nurses and passes it on to the family. Meets the family at the time of discharge of the patient from the hospital. She ensures that the family is prepared to look after the patient at home. Standards for social caseworker in a medical setting. Standard 1. Ethics and values. Social caseworker adhere to the values and ethics of the social work profession, which is rooted in 6 core values: service, social justice, dignity and worth of the person, importance of human relationships, integrity and competence. All the social workers have a responsibility to hold these values as a service to clients, the profession, self, colleagues and society. Social caseworker shall acknowledge the right of the clients to receive competent psychosocial services and demonstrate commitment to act on professional judgment and convictions. Social caseworkers shall be prepared for the challenges that encompass the assessment and treatment of the people with behavioral and emotional disturbances. Standard 2. Specialized skills and interventions. The social workers in medical setting show specialized knowledge and skills for effective clinical interventions with individuals, families, couples and groups. Social workers must be familiar with the factors such as social, psychological, cultural and health that influence the mental, emotional and the functioning of the client. They have to acknowledge the theories of personality and behavior and be aware of the socio-cultural and environmental influences and conditions that have an impact on the physical and emotional state of the customer. In addition, the social workers of the case will have the ability to establish and maintain a relationship of mutual respect, acceptance and trust, gather and interpret social, environmental and health information, staff assessment and deal with problems within their scope of practice, establish feasible treatment, accompanies the client. Standard 3. Referrals. Social workers must evaluate confidentially on community services and make recommendations appropriate to the need. To ensure that clients receive services best possible, sometimes useful to collaborate or coordinate services with appropriate community based programs to strengthen or improve the continuity of care. Standard 4. Accessibility to clients. Social case workers must be available to provide clinical services to customers during regular appointments or sessions. In addition, social case workers should develop contingency plans or be available for the customer of emergency protection during holidays, illness and other times when the office may be closed. Standard 5. Privacy and confidentiality. Confidentiality is a fundamental principle of the intervention of social casework. All information related to or obtained from clients should be considered as private and confidential unless the client gives prior consent to release or discuss the information with a third party. The social worker must notify the client of confidentiality restrictions and requirements at the beginning of the treatment. Standard 6. Supervision and consultation. Social workers must ensure that professional supervision is being available in a medical setting. If the social worker supervisors are not available, then the case consultation may come from qualified professionals from other related disciplines. Standard 7. Professional environment and procedures. Hospitals offering social work services in camera need to develop and implement written policies that describe their office procedures such as rights of the client, including the rights to privacy and confidentiality and coverage services in emergency situations. The treatment setting must be properly maintained in order to ensure a reasonable degree of comfort, privacy and security for the worker and the client. Standard 8. Documentation. Social workers must document all services rendered to the clients and keep records in a location that is secured as private and confidential records. Documents should reflect an accurate nature of services. Standard 9. Independent practice. Social case worker may establish an independent or group practice. When doing so, they ensure that all services including diagnosis and treatment planning meet professional standards. Standard 10. Cultural competence. Diverse population seeking psychosocial services require social workers to raise their appreciation of cultural differences. Standard 11. Professional developments. To practice effectively, social case workers must stay well informed about new theories and interventions, models of best practices in the profession of social work and the changes in policies and the regulations. The social case worker should regularly participate and contribute to professional conferences and training and promote professional publications. Standard 12. Technology. Social caseworkers are increasingly using computers, websites and other electronic technologies to improve the quality of services to clients, to communicate with other professionals and for documentation purposes. Social caseworkers should engage in training in the applications of relevant technologies for the practice of social casework, including the assessment and education to treatment policy, research and resources, monitoring and development. To sum up, we can say that the role of a social worker in the medical setting includes making patients become more self-reliant, strengthen family relationships, the restoration of the social functioning of the individuals, families and groups. Social caseworkers use their knowledge and skills to provide best services for clients and patients. Social workers support clients and patients, increase their problem solving abilities, obtain necessary resources, facilitate interactions between individuals and between people and their environments.